Well, welcome everybody. So this is a doc talk, so if you are in the wrong place, you can leave and nobody will make fun of you. So my name's Jaime Goodman. I'm the endocrinologist here, and I was asked to give a doc talk. You could talk about anything you want. So I said, okay, well, I'll talk about diabetes because lots of people have diabetes. And they're like, okay, talking about what is diabetes. I'm saying, oh, no. I'm going to talk about lots of different stuff about diabetes and how I take care of lots of different problems with diabetes, and I work with the heart and the kidneys and the brain, and now we have medications that really exemplify that. So I decided to call my talk Apples to Zucchini, because of course that's everything that you find in my house, only healthy things. In case somebody doesn't know, diabetes is an epidemic. Really, it's a pandemic. So lots and lots of people in the world have diabetes, and it's getting worse. If we bring it to America, lots and lots of people in America have diabetes. It's also getting worse. We are here in Ohio, so the redder, darker you are, the more people percentage of your state has diabetes. We are pretty red. So one of the problems is there are lots of people who have diabetes, but there are also lots of people who have diabetes, but they don't know it. So that's kind of like people who have diabetes, they know it, but they don't want to be treated. But just because they don't want to be treated doesn't mean their organs don't know that they have diabetes. Their organs are still being damaged. So all of these people are still at risk for all of the complications of diabetes, and that's what we want to prevent, that we want to protect all of their organs. So what exactly is diabetes? Sugar is very important in the body. It is like money to the body. So diabetes is different diseases, but all of them have glucose problems. It affects how the body uses glucose. Glucose is energy for all of the cells, all the muscles, all the tissues that make up our body. The brain is extremely important for the brain. The brain is glucose dependent entirely. It will not use fat as energy, so fat is like our storage form of energy, but the brain will not use fat. So every type of, So every type of diabetes leads to excess sugar in the blood. So I explained diabetes like, it's like you're thirsty and in the ocean. There's a lot of water in the ocean, but you can't drink it. You could drink it, but it's not going to quench your thirst. So how do we diagnose diabetes? There's 3 different ways to diagnose diabetes. The latest way we do it is with a hemoglobin A1C. So we take some blood. We know on average people's blood cells last 3 months. So we look at the hemoglobin, which is the protein in the blood that carries oxygen, and we see the glycosylation index of that blood, basically how much sugar is on that protein. And then we correlate it to how much blood sugar is in the blood. And if you have 6.5 or more, that's diabetes. If you have 5.6 or below, that's normal. And in between, it's prediabetes. Or if you have a blood sugar over 200 and you have symptoms, and we'll talk about the symptoms in a minute. Or the gold standard of testing is a 2-hour glucose tolerance test. So we get a fasting blood sugar, then we give you a sugary orange drink, and then 2 hours later, we check your blood sugar and see how you tolerate it. Is your body able to bring your blood sugar down? Do you make enough insulin to combat that sugar? And you have to have 2 or more of these tests. They could be any combination of the tests. They could be 2 of the same test. But we want to actually make sure that we're not just having a bad day on testing day, or like we're sick or something. So what are the symptoms of hyperglycemia? Well, you can have frequent urination, frequent thirst. And this happens because when you have high blood sugars, your kidneys excrete that sugar in the urine, and then you get thirsty to replace that volume. Or you feel hungry because your cells are not able to utilize that glucose as fuel. They turn right around and tell your brain that you need glucose, you need sugar, you need fuel. So you get hungry. Or you get weak because you basically have no energy. You lose weight. So, lots of us like to lose weight, but this is not a good way to lose weight. And this happens because you're spilling glucose in your urine. Glucose, sugar, it's calories. So you're dumping sugar in the toilet, but this is not a good way to lose weight. You have blurry vision because the eyes are sensitive to sugar. There's a sugar type molecule in the lens of the eyes. So as blood sugar goes up and down, the lens of the eye sugar goes up and down. So it's like wearing different people's glasses different times of the day. You can feel nauseous. You can have slow healing of cuts, bruises, and this is why people get infections that don't heal. And you can have tingling in your hands because it affects other electrolytes and nerves. So what are these complications of diabetes? Well, we'll start here with the eyes. So you have retinopathy. That's why people with diabetes should be going to the eye doctor at least every year. And it's not, welcome, come on in. And it's not just to find out what glasses prescription you need. It's to find out, are your eyes being damaged by diabetes? Because there's things that we can do about that. Periodontal disease. So the pediatricians, the family doctors, they tell us, don't put your kid to sleep with a bottle because you don't want sugar in your mouth all night long. Well, people with diabetes that's uncontrolled, their saliva has lots of sugar in it. So that's like being with a bottle all day long in your mouth. When our kids were really young, we would go to the restaurant and they're like, oh, does your kid want Coke? Like, they're like an infant. No, but yeah. And then peripheral vascular disease. So diabetes is a vascular problem. It's a blood vessel problem, and that includes the blood vessels to your feet. So this is why patients with diabetes have problems keeping their feet, because they don't heal well. If you don't get blood flow to your feet, they don't heal well. So that's how they get foot damage. Also with the feet, diabetic neuropathy. So the nerves that go to our feet, they're the longest nerves in the body. So that's where this nerve problem starts. We call it a stocking glove type pattern because it starts at the feet. And when it gets to around mid-shin is when it starts to affect the fingers. And if you can't feel your feet, then you don't know that you stepped on a Lego in the middle of the night and that you have a sore on your foot, so you don't get that taken care of. And we have kidneys, because the kidneys do not like extra sugar going through them. It damages the kidneys. The kidneys also are supplied blood by the heart, and those blood vessels are also damaged. The heart has lots of blood vessels in it, and it supplies everything with blood, and it is damaged by blood sugar. And then the brain, it will only use sugar as fuel. And lots of people with diabetes wind up having strokes because it has lots of blood supply to it, and those vessels can be damaged. So that's why I say I deal with the whole body. So there were studies done in people with type 1 diabetes who don't make insulin. There were studies done in people with type 2 diabetes who make insulin. They just don't utilize their insulin very well. What all these studies show is that as your A1C goes up, all of the complications go up. So that's all of these. Type 1 with eye disease, as your A1C goes up, your complications go up. Vascular, as your A1C goes up, the complications go up. and it's exponential. So like from an A1C of 7 to 8, it's a little bit. From 8 to 9, it's a lot more. Our lab goes up to 14. After 14, it just says greater than 14. The really great news is not only can our treatments prevent these complications, the treatments and prevention are sustainable. So we have all this great treatment, including insulin. There's no high dose of insulin. You can go up as high as we need. Why don't we just give lots and lots of drugs to everybody? Well, because we have risks of treatment. And the risk of treatment is hypoglycemia. So if I give people so much medicine, I can cause low blood sugars, and that is also a bad thing. People can also feel hungry, because then they also don't have enough fuel for their body, so their cells turn around and tell you that you have to eat. You can have a headache or dizziness, sweat excessively, be irritable, and you get adrenaline surges, and that come on in. And that can make your heart beat really fast. And because of your heart beating really fast, people with heart problems, they are at increased risk of having more heart problems because of that fast heartbeat. So I want to talk about new medications, but first I want to talk about the oldest medication we have. It's metformin. And the reason I want to talk about it is because it gets a bad rap, but it's a really great medication. So we actually don't know all the ways it works. We know that it helps the muscles take up sugar. It helps the liver take up sugar. We don't know exactly all how it works. But it gets a bad rap because its predecessor drug, fenformin, caused a muscle problem called lactic acidosis, which goes through the kidneys and can damage the kidneys. Metformin doesn't really cause this. And really good things about metformin are that it is cheap. It can also cause weight loss. A couple months ago, I actually put a patient on this, and she actually called my office to tell me that it was so good and she's lost so much weight with it. I never had that happen before. And I actually saw her back, and she's thrilled. It doesn't cause low blood sugars. So we give it to people who don't have diabetes. We give it to people for other reasons. So it's not going to cause those low blood sugars that we don't like. It's actually been shown to improve longevity. So it's shown to help people live longer. So those other things that we give it for are fertility, like people who have polycystic ovarian syndrome. It's been shown to decrease risk of colon polyps. So it decreases colon cancer. People with prostate cancer who took metformin lived longer. People with diabetes on metformin were less likely to die of COVID. People with obesity had less risk of developing diabetes years after. So this was part of the diabetes prevention trial in America. 2 other studies were done elsewhere in the world, but they did well on metformin. And people on metformin with diabetes have a lower risk of dementia. So metformin is actually a good drug. There can be side effects. So everything there's good and bad. With metformin, it can cause nausea, vomiting, diarrhea, gas, indigestion, stomach pain, GI stuff. Can also cause headaches, weakness. Nobody knows why, but it can cause low vitamin B12. I look at vitamin B12 in all of my diabetic patients, even if they're not on metformin. It can cause a change in taste. So the serious problem that we worry about is lactic acidosis, but it's extremely rare. One of our newest types of medications are the SGLT2s. So these are sodium glucose transporter type 2s. So this is a nephron. So this is what the inside of the kidney looks like under microscope. So in the tubules of the kidneys, we have these SGLT2s. These are transmitters. Here's how this works. All day long, your kidneys see all of your blood, many, 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 many times. They take all of the sugar that's in your blood and they dump it in the urine. Then these channels, these SGLT2 channels, take that sugar and put it back into the blood. Yes, this is weird. We think we do this whole rigmarole thing with the sugar from the blood to the urine back to the blood because we used to have to spend a lot of energy hunting and gathering food. We did not want to waste those calories in the toilet. But now we go to the supermarket, we give them some plastic credit card, they give us food. I don't know where people are going to get their liquor without Rite Aid. I don't know. Liquor has a lot of calories. I don't know about the liquor situation here. So we reuptake all of that sugar. But we're not spending all this energy getting those calories anymore. Very easy to go to the supermarket. So we would love to waste extra calories in the toilet, at least most of us. So there are companies that make pills that go into our kidneys and they block those channels, so they make us urinate out extra sugar. Well, didn't we say earlier on a slide that urinating out sugar is bad? Well, it's bad unless we're trying to do it and giving you a pill to do it on purpose. And this came because there's like 10 or 12 families in the world that have genetic problems with these channels, and they do it by themselves, but they don't get kidney problems, they don't get heart problems, they don't get diabetes, they're fine. So that's where this came from. So we make people urinate out sugar. So there are 4 of these medications: Jardiance, Farxiga, Invokana, and Steglatro. Good things about these medications: they're pills, they're easy to take. They don't cause low blood sugars. We can give them to people who don't have diabetes, and in fact, we do. It decreases progression of renal dysfunction. So our kidney doctors give it to their patients who don't have diabetes because it helps protect the kidneys. That's good because kidney disease, the leading cause is diabetes. So if I can protect the kidneys, that's great. It decreases the risk of heart failure, both hospitalization from heart failure and death from heart failure. So our heart doctors give it to their patients who don't have diabetes. Also really good because a lot of patients with diabetes are going to have heart attacks and strokes. So if I can protect their vasculature, great. It can decrease blood pressure, which is great for a lot of people because they have high blood pressure. And it helps with weight loss because you're urinating out those extra calories. Bad things about these are they can cause urinary infections or yeast infections because you're urinating out extra sugar, and yeast and bacteria, that's what they eat. So you're like having a buffet for them. So we work on hygiene, and we want you to drink lots of water to dilute that sugar. On all of the commercials about these, they talk about Fournier's gangrene, which is a very bad infection that's really rare. It happens to people who get urinary infections and don't get them treated. It can increase cholesterol by a small amount. It can cause diabetic ketoacidosis if you're needing insulin, and because you're on this medication, you now need less insulin, and you're not eating well, and you're not drinking well, and you're sick, you can get into this problem. Maybe it causes increase in fractures. We're not really sure. It can cause lightheadedness because when you're urinating out sugar, water follows. So it's a diuretic, a water pill, which means it lowers blood pressure. So you can feel lightheaded on it, which means we might need to lower blood pressure medication. Another newer class of medication are the GLP-1s, which are glucagon-like peptide type 1. And there's also one newer one called GIP, which is glucagon-like peptide type 1, but it also has gastric inhibitory polypeptide in it. It's the only one in that class. So these are ones like Byetta, Bydureon, Victoza, Ozempic, Trulicity, Rybelsus. There's medications that combine an insulin and one of these called Soliqua and Zoltify, and then there's Mounjaro. And these are the ones that you hear about being on back order, and we'll get into that in a little bit. So how these work is multifactorial, but these are the incretins. So these are what the gut typically makes. So when people make insulin, for those of you who make insulin, that's great. When you eat, you make insulin, you make this GLP-1 hormone. This GLP-1 hormone slows down the gut from emptying so that you get time to deal with the food that you've eaten. It also tells the liver to stop making so much sugar. So the liver is like a garbage can for the body, but the other thing it does is turns fat into sugar so that when you're not eating, you have a fuel source. But when you start eating and you make this GLP-1 hormone, the liver can stop turning fat into sugar.